Hey, happy Sunday to you. Just wanted to reach out and share a little bit of information that I know. I'm sure there's a lot of information and misinformation about the coronavirus and COVID-19. I'm an internist and I work in an office setting, which is right here. And I also work in skilled nursing facilities in the state of Washington. And it's one of the places actually not far from where we used to work, where one of the residents in that facility was diagnosed, and I believe there's 2 residents now and a staff member, and lots of people quarantined. I think they have dozens that are actually coming down with symptoms. So there's a lot of people that are, let's just put it straight up, freaking out because of what's going on. And it's understandable. You know, when you hear this, it's kind of a black box and it's scary. You're thinking like this is some disastrous thing, and in theory it could be, but I just want to put some context into what we actually know. So, hey, Joanne. So, for one thing, you know, when we're talking about influenza, which is, you know, not the coronavirus, not the COVID-19, influenza has actually affected, I have some numbers here, 32 million people this year. A third of a million were hospitalized, and 18,000 people have died. And that's in the United States, as I understand it. So, if anybody knows better numbers, you're welcome to text it to me or put it in the chat. Hey, Lena. So, you know, the penetration of the virus, the COVID-19 or coronavirus, is unknown. It's not clear to anybody exactly how many cases there are, because there may be some misinformation, hey Cole, from some of the countries that are reporting or not reporting. So, you know, in some of those countries, I mean, I don't know, obviously, but I'm just saying that, you know, China, Iran, other countries that we don't have great relationships with, you know, Russia, they may not be reporting all the true numbers that they have. But right now, the best estimate is that about 2% to 3% of the cases are fatal. And what's interesting is that the countries that are reporting and that are tracking this more closely and are being transparent with us are telling us that about 80% of the cases are mild. And so I think we have to keep that in mind, that, you know, don't lose your mind if somebody's coming down with symptoms, but 15% of the cases are severe and 5% of them are critical, and like I said, about 2 to 3% potentially could be fatal. And so, you know, what are the signs and symptoms of this illness? They're actually very similar to the flu, so you really don't know if you have the flu versus the COVID-19 or coronavirus. Hey, David. You know, so fever, cough, body aches, headache, those are the biggies that are common with both the flu and this coronavirus or COVID-19. But the big one that you really, you know, this is the time when you really need to go to the hospital and get evaluated would be if you're short of breath. That's the big one. And so, like I said, about 80% of the cases are mild. The thought is that children and young adults actually are much more likely to have mild cases or even nearly asymptomatic cases. And the more severe cases, like I said, 15% are considered more severe, and 5% are to the point where they're, you know, just deadly. And then of those, 2 to 3% are passing away. Ultimately, it's going to take months and maybe even years for people to understand exactly what the toll of this illness has been, because there's a lot, like I said, there's a lot of misinformation. Even the testing kits that were out there, and some of the ones that are being used are not necessarily measuring the COVID-19. I mean, now I guess they've straightened it out, but there were some that were actually getting a lot of false positives. The incubation period for this is about 2 to 14 days is the range that I saw. So just to clarify, that means that if you're out at the grocery store and pressing your keypad on somebody who just wiped their nose and put their face, you know, or put their hand onto the keypad that you just touched, and then you wipe your nose, you can get it that way. So I'm going to get to how do you actually prevent this. Wash your hands, don't touch your face. But, you know, you could get sick in as short as 2 days or as long as 14 days after exposure. And so the question that I don't know the answer to, I know I've heard people should be quarantined for 14 days, people should be quarantined for 7 days. I'm just going to give you my educated opinion about that. I understand why the quarantine is recommended and thought to be necessary, but could you imagine that every single person that works in an emergency room, every single EMS person, firefighter that gets exposed to this is in the same building with it? You got to stop working for 14 days or even 7 days? We are going to have an immense shortage of people that are able to support this effort. So I don't know how that's going to unfold, but I have a suspicion that eventually, heaven forbid this becomes bigger than it is at this point, and it seems like it's getting much bigger quickly. You will see some changes in terms of who needs to be quarantined, who can go to work, and all that stuff. But that comes to my next point, which is really, if you're feeling sick and you're not short of breath, but you're feeling sick, don't go to work. Don't go out, unless you absolutely have to for some reason. And then, another question is, should I wear a mask? Should I be carrying around hand sanitizer? That's actually not a bad idea. See, the part about the hand sanitizer. The mask is actually a bit controversial, and I know that's a controversial statement, but they say the N95 mask is the best one to wear. But what I know as somebody who works in the healthcare industry, we actually do something called fit testing, which is required by OSHA. Fit testing is like a really complicated fitting of the mask. And let me tell you something. People that want to wear an N95 mask, I'm going to give a quick demonstration. This is not an N95 mask, but how much of that does cover my beard? Is that covering my beard completely? Yeah, I didn't think so. So a guy like me, I actually have to wear a full helmet. So, and people that wear beards, yeah, you could. Some people say just wrap it up, and you can put some hole over it or whatever. But there's actually a hood, makes you look like one of those hazmat people for people like myself. And if I'm actually working in an environment like a hospital, which I used to, I don't anymore. They used to have these hooded devices that had like a hose on the back and a pump that would have a HEPA filter. So thankfully that's not the point where all of us have to be. But wearing a mask in terms of just quick droplet precautions, protecting yourself from other people, sure, it's not going to really hurt anything. But there's a lot of statistics out there that say that if you re-wear the masks, or if you're wearing for a longer period of time, I don't know the exact number, I know that they basically become less effective because of the moisture that your breath produces on the mask. So the bottom line is that if you're feeling sick, but you're not, terribly ill to the point where you're short of breath at all, you don't need to necessarily go to the hospital. Perhaps you could do a telemedicine visit, or call your doctor's office. If you're feeling short of breath at all, yes, I do think you need to go see your doctor, and actually probably an urgent care or an emergency room would be the best way to go. As far as your approach to managing your risk and the risk of your loved ones, having the hand sanitizer around, something I believe they say it's 60% strength or concentration. This one has ethyl alcohol 62%. That's the strength that's recommended. And then it's so easy to we can't prevent people that are uncontrollable for touching their eyes and their nose and stuff like that. So I take care of a lot of people that are in dementia units and things like that. It's hard for that, you can't just sit there and instruct them and re-instruct them. Oh no, don't touch your face. How are you going to do that? Same thing with kids. You're going to be even if a kid's 9 or 10 years old, he's not necessarily going to listen to you or think about it when he's out there running around playing, and then he, is touching his face and touching his other kids and whatnot. There's only so much you can control. And then, what we can do as adults and people that can think about this stuff, use hand sanitizer, try not to touch your face and your mouth. And then if you want to go with droplet precautions, wearing a mask, which I said is controversial, and you can rewind and see why I said that is. So anyways, I hope this is helpful for those who are kind of freaking out about it. A couple things I just wanted to touch on. Some folks were saying, is it possible that the weather is going to get this better as soon as the warm weather comes? It's actually not known. I know that there's a seasonal effect on the transmission of flu, and so we think of a flu season. So is there going to be a COVID-19 or coronavirus season? I suppose that's certainly possible. We don't know that for sure. Will people be immune? Could you get it again? And that's also not known. There's a lot of people that can make an educated guess and say, well, once you've had it, you can't get it again. But the thing about virology and about infectious diseases is that you can have small changes to these viruses that make you more susceptible to them again. So anyways, take a deep breath, have some faith that something bigger than all of us is out there that's watching over us. Not to say that that's going to solve our problems. You got to be smart. Don't touch your face. Use your hand gel. Don't go to work if you're feeling lousy, and go seek medical attention if you're short of breath. So anyways, I hope that's helpful, and hope you all are doing very well, and we'll get through this.